Chlamydia is an infection and is considered as a public sexually transmitted infection. In detail, in the US unaided, around 2.8 million suitcases of this infection are recorded every year. This infection is caused by the Chlamydia trachomatis. The bacterium that causes the infection on humans is found purely inside human cells. The transmission of his bacteria can be through vaginal, anal or through oral sex. Usually, patients who has this infection doesn't know that he has the infection. Symptoms are rare and may not show on personnel who take the infection. So most of time the persons who has this would usually go on with their customary activities and may compromise their shape and the vigor of their partners in the long run. Treatment for chlamydia: if this infection residue organic for a long cycle of time, then this infection can cause humorless strength troubles for the enduring, and the troubles can be in little word or for a long designate. This disease could be treated with the use of antibiotics. Some of the treatments that are regularly optional contain the intake of erythromycin, the doxycycline, the tetracycline and the intake of the erythromycin. There is an untested action as well that can be used, and this is the intake of the ciprofloxacin. It is optional that 500 mg of this should be taken twice daily for 3 living. Nevertheless, this kind of medicine, however free in the cell, is not yet accepted for use as a scheme of action. Generally, for a part who has this infection, 2 regimens are recommended and numerous swing regimens are optional as well. The healing that would be best for you may adapt on several factors. If you have a tangy memory and you think that you can recall to take the pills as suggested for 7 days without fail, then this regime might be right for you. Nevertheless, if a serene can find it obstinate to remember all these things and he thinks that he cannot follow the suggestions, then a track dose procedure is fitting for the persona. The trial with a definite dose procedure is that this can be a bit pricier. The wealth deceit on the unwearied, of course. Whatever procedure may be preferred by the serene, he can surplus secure that the infection can be addressed. The alternative regimens contain the intake of ofloxacin or the levofloxacin and the intake of the third one, which is the erythromycin. Nevertheless, the erythromycin is considered to be less helpful if compared to the other 2 drugs. If an enduring is being treated for this infection, suggests the partner of the patient should be treated for this as well. This is necessary so that the infection will not move from the patient to the partner and vice versa. It is suggested as well that once remedy has been happening, sexual activity should be stopped. And if it isn't likely, suggests the patient should use condoms for any kind of sexual activity. Please subscribe to our channel and give this video thumbs up. Share this video with your friends on Facebook and Twitter. Thanks for watching.